I'm going to talk on the OAE International Standards and Guidelines on highly pathogenic avian influenza surveillance. Before starting on the guidelines, I want to take you through one of the most important OAE objectives. The OAE is there to safeguard world trade by publishing health standards for international trade in animals and animal products by mandate under the WTO SPS agreement. This is a very important objective of the OAE because international trade is very important for many countries and also for developing countries. And by producing animal health standards, the OAE wants to safeguard trade and to avoid unnecessary trade implications because of animal diseases. The OAE has several standards for terrestrial animals. The most important is the Terrestrial Animal Health Code that contains the standards on the OAE notifiable diseases for trade in animals and animal products. There is an accompanying manual of diagnostic tests and vaccines for terrestrial animals that gives the different diagnostic techniques that can be used to detect these diseases, and also gives guidelines on vaccine production, general guidelines on quality assurance, but also specific guidelines for the different diseases. Why are international standards for animal diseases necessary? From the OAE point of view, we say it's an international public good. It's extremely important for the safety of international trade. It's extremely important to know under which circumstances it's safe to trade animals or animal products. And this will certainly lead to fewer disease outbreaks. The standards can be used to harmonize national legislation and control measures. By harmonization between different countries, we will have fewer unjustified trade restrictions, which will again lead to fairer trade, which is of extreme importance for the developing countries. Looking at the OAE standards on avian influenza, we have in the Terrestrial Animal Health Code, Chapter 2712 on avian influenza. We have the Terrestrial Code Appendix, which gives the guidelines for the surveillance of avian influenza. These guidelines are important for the surveillance during an outbreak, but also for countries to become free of the infection again. In the manual, we have the diagnostic techniques for avian influenza and a part on avian influenza vaccine production. And currently the OAE is in the phase of development of guidelines on the implementation of avian influenza vaccination. The OAE Terrestrial Code has been updated in 2004. That was important because, as you can imagine, the OAE has about 100 listed diseases and we cannot update every chapter every year. But in 2004, when the avian influenza crisis really started, the virus spread from Southeast Asia in 2004, 2005, 2006 over more continents, and we thought it was important to update the chapter taking the most recent scientific findings into considerations, and also to develop specific recommendations for the most important commodities being traded. And that is live poultry, but all poultry products, meat, processed meat, eggs, but for example also feathers and down. We wanted to encourage transparent reporting, and for that reason we have differentiated the trade restrictions between highly pathogenic avian influenza and low pathogenic avian influenza. I want to take you shortly through the different definitions. So we have introduced the term notifiable avian influenza. Notifiable avian influenza can be either highly pathogenic or low pathogenic, but it's an infection of poultry caused by any influenza A virus of the H5 or H7 subtypes. It's important to notice that we use the word poultry because an infection in wildlife of avian influenza does not fall under this definition. The notifiable avian influenza is really restricted to an infection of poultry. And then we of course also need a definition of poultry. Poultry is all domestic birds reared or kept in captivity for the production of meat, eggs, or eggs for consumption, for the production of other commercial products, for restocking supplies of game, or for breeding these categories of birds. Then going to the guidelines for the surveillance of avian influenza. These guidelines are an appendix to the code chapter where we define the notifiable, the highly and the low pathogenic avian influenza. The guidelines for surveillance defines principles and provide a guide for the disease surveillance. And that is to seek recognition for a declared free notifiable avian influenza status, which means that we can only declare a country free from avian influenza in poultry and never from avian influenza in wildlife. It's important to say that the OIE does not have a disease-free recognition for avian influenza. The guidelines give guidance to a self-declaration of countries of freedom for avian influenza. And that is really important to say that it's not an OIE recognition. The declared free status, so the declared free status by the country, can be maintenance of a free status or following an outbreak. It can be with or without vaccination, because in principle, vaccination does not interfere with freedom of a country of avian influenza. And also important to add, application can be made for a country, a zone, or a compartment. When the country provides its information to the OIE, and the country has followed the guidelines for surveillance, the OIE will publish the information on its website. The general conditions for surveillance of avian influenza. A surveillance system should be in place under the responsibility of the veterinary administration. There should be a system in place to detect and investigate outbreaks of avian influenza. There should also be a procedure in place for the rapid collection and transfer of samples from all suspected cases. This is important because we feel that when there is a suspicion of avian influenza in a country, the suspicion should be treated as infected until the infection has either been ruled out or confirmed. So a procedure, a rapid procedure for collection and transfer of samples is necessary. There should also be a system in place for recording, managing and analyzing the diagnostic and surveillance data. The surveillance program should include an early warning system throughout the whole production, marketing and processing chain. This is important because the country should be able to detect immediately any outbreak of avian influenza. There should be an immediate clinical and lab investigation of all suspected cases. For the reason that I just mentioned, it's important to get a very quick confirmation or ruling out of suspected cases. There should be a surveillance system in place, so there should be regular and frequent inspections and testing of risk groups. There are different surveillance strategies, but what we say is that the surveillance should be targeted at all susceptible poultry species in the country, zone or compartment. And it's also important to say that surveillance should be active and passive. So it's important to actively look for the infection, but also to have a passive reporting system in place and to be sure that there's a general awareness of the disease. For example, that when farmers have an increased number of dead chicken, that they report that. So what are the different possible active surveillance strategies? The clinical surveillance, the serological surveillance, and the virological surveillance. And these active strategies can be either random or targeted. In targeted surveillance, you direct your surveillance especially to the high-risk groups. So random surveillance is actually based on statistically based surveys of all susceptible poultry. But sometimes you really know that there's an increased likelihood of infection in particular localities or species, for example with the free-range animals. These animals may be tested more frequently than the animals that are kept under high biosecurity. The country should be able to show that the strategy chosen is adequate to detect the infection. Looking at clinical surveillance. Clinical surveillance is of course more important for highly pathogenic notifiable avian influenza than for low pathogenic notifiable avian influenza. And it's actually the detection of clinical signs of notifiable avian influenza at the flock level. And herein the role of the farmer is very important. The farmer should be aware of the signs of clinical disease. As said previously, the suspected animal should be classified as infected until evidence of the contrary. So that actually means that we should impose certain measures like movement controls, increase of biosecurity, until the infection has been confirmed or ruled out. Virologic surveillance is very important to confirm clinically suspect cases, because with clinical signs there are often no antibodies developed yet. So it's very important to send in samples for a virological confirmation of the clinically suspect cases. Virological surveillance can be used to monitor risk populations. When there are sick or dead animals in risk populations, they should be tested virologically. It's also important to follow up positive serological results with virological surveillance. And a very important point for virological surveillance is to test the normal daily mortality. When there are flocks where the number of dead animals increases, or when there are free-range flocks in a risk area, it's extremely important that all these dead animals are sampled to ensure early detection of infection in the face of vaccination or in establishments epidemiologically linked to an outbreak. Serological surveillance is most useful in non-vaccinated flocks. It is possible to use serological surveillance in vaccinated flocks, but only when a heterologous vaccine has been used. It is of course also possible when you have sentinel animals in a flock for post-vaccination monitoring to use serological surveillance. It's important to sample these animals on regular at regular times to be sure that there is no seroconversion in your sentinel animals. When you find more positive seropositive animals in a flock, it's really important that there is an epidemiological investigation and a virological follow-up of these seropositive flocks. For vaccinated flocks, it's a little bit different, because vaccinated flocks have antibody titers. So in principle, you cannot really use the serological surveillance unless you make use of a heterologous vaccine. So the surveillance strategy in vaccinated flocks is dependent on the type of vaccine used. In vaccinated flocks, it's also possible to use unvaccinated sentinel birds. They should be permanently identifiable and they should be regularly tested virologically and serologically And if any of the sentinel birds get sick, they should of course be sampled and tested. It is possible for vaccinated flocks to become free of avian influenza, but the OAI guideline says that the country should be able to declare at an acceptable level of confidence that vaccinated animals are free of the disease. And for that reason, a good surveillance strategy, either with diva animals or sentinel birds, is very important, because otherwise it's impossible to show that vaccinated flocks are free of the infection. Then coming to the end, when a country would like to apply for freedom, and I want to repeat, it's a self-declaration for the country, but the information can be published on the OAI website. They need to give a description of the surveillance system in place. They should provide well-reasoned arguments to prove the absence of notifiable avian influenza in the country zone or compartment, and at an acceptable level of confidence. And this can be either for a vaccinated or a non-vaccinated population. There should be a follow-up of all suspicious cases, and the country should show that they really have this good surveillance system in place. They should show the results of testing and control measures during an investigation, and vaccinated flocks need to ensure the absence of the virus. When countries send the applications to the OAI will see whether the applications are according to the guidelines, and if the country does show at a high level of confidence that it's free from avian influenza, the results will be published on the OAI website.